There are two things that are serious with tamoxifen that we have to mention as part of our responsibility to you, our viewers. One is tamoxifen increases the risk of blood clots. It doesn't increase it a whole lot, but in somebody who's at higher risk and who is not on a blood thinner, that increase in risk of blood clots might not be acceptable to the patient and her medical team. So if you had a blood clot when you were in your 20s and there was no precipitating factor, you weren't on birth control pills, it just happened and nobody can figure out why, then being on tamoxifen might not be in your best interest unless your doctor thinks you're at high enough risk even without tamoxifen and thinks you should be on a blood thinner. We do not recommend tamoxifen plus a blood thinner as treatment for preventing blood clots from tamoxifen. The bleeding risks are higher. And similarly, there's no evidence that aspirin plus tamoxifen is a proven strategy to decrease the rare, but yes, indeed, documented risk of blood clots. And the other thing is, if you are concerned about vaginal bleeding, tamoxifen has many more side effects in terms of irregular menstrual bleeding, polyps developing, and there's a rare but real risk of an increase in cancer of the uterus or endometrial cancer. So those are things to think about if you've had problems with bleeding, if you've had concerns about cancer of the uterus and you still have your uterus.